Hi, I'm Afni Shah Hamilton and I'm the owner of Tiptoe Foot Care, a podiatry clinic which also runs a specialist pain management and movement clinic within it. In my other video I spoke about how podiatry can help with a number of pregnancy related problems that affect the leg and the feet. In this video I'm going to explain how we can use our pain management and movement clinics to help you overcome joint, muscle and movement pain that can be particularly caused by pregnancy and postnatally. I often see patients who have long-standing pelvic girdle pain, SPD, hip pain, knee pain and a multitude of other foot pains. They also come to me sometimes and they don't want to discuss, but they get quite embarrassed about difficulty and pain when going to the bathroom as well. I realise there are a number of different therapies out there that can assist with joint pain, and especially looking at different parts of the body. That's great when you know exactly what the problem is, but during your pregnancy, there are a lot of number of different changes happening all at once, and finding out what the cause is and how the body is compensating for it is really important. My approach is slightly different, and I use my training in a number of techniques, including anatomy and motion, systematic kinesiology, and podiatric medicine. And I look across the whole body to find what the root cause is on why you're experiencing the symptoms you're getting. And that is really key to how we work. If we can treat the underlying causes and it gives you a much more longer lasting relief and saves you time and effort and going through a loop where you get treatment for a particular symptom, you feel better for a short period of time, and then as the body starts to readjust again, it starts to reoccur and you end up repeating the pattern over a number of months or weeks depending on the severity of the situation. By putting together a number of seemingly unrelated issues, I am able to join up the dots and find what the source of the problem is. My patients often find it surprising and sometimes disconcerting when I've been asking about, are you getting headaches or jaw issues or something else when they're coming in with their knee problems. And actually they find it quite amazing that I've actually managed to pinpoint other areas that they haven't told me about. Often I'll find that where the pain is in one area is caused by the body compensating for problems elsewhere and putting additional strain on the joints and muscles as a result. I'll give you some technical explanations later, but for now maybe we can think of our bodies as a Jenga tower. And initially our bodies are nice and strong and stable, just like this nice solid tower. But over the years we accumulate injuries, and this is like pieces of the Jenga tower being knocked out of place and becoming less stable. Some of these injuries may be major and minor, such as stubbing your toe, maybe a twisted ankle, a broken wrist, or a whiplash injury. Some injuries you might have found to be insignificant and you didn't notice at the time, but these may influence what you can do later on, even though at this stage certain blocks just can't be moved. And if they do, the body will lock it down and send out pain as a warning sign of danger. Of course, pregnancy puts lots of strain on the body and on the tower as the weight is redistributed. And sometimes this can often fast track some of these problems. But if we properly address some of the old injuries or find ways to support them, we can restore balance to the tower and allow other parts to move correctly. So already you can start to see that the tower is becoming much more stable again. The reason why I like using the Jenga tower as an example is because it highlights two things. The first thing, it can explain to patients why they're getting a neck pain or restriction, and it can be caused by the foot issues as the body is perhaps trying to compensate for a number of areas of weakness on one side, and it prevents moving something higher up. Also, number two, identifying and fixing issues at the base, particularly things like the feet, knees and the toes, can often give the greatest reward as they affect the stability the most of the whole tower. If there are issues in that area that are left unaddressed, you're likely to continue to struggle however much work you have and treatment you have done further up the body. As a podiatrist, fixing feet is my professional area of expertise. To show you aim in practice and some of the things I'm looking for, I've asked Catherine to join me so I can give you a quick demonstration. So when I'm looking at Catherine, we're going to assess from the foot upwards. So I've taken a picture of the foot to show that this foot, the heel is turning in a bit more You won't see it so easily because that's more to do with the trained eye, but I thought I'd give you some visual on what else we're looking for. So we can see that on Catherine, this knee is slightly more bent and it's slightly more protruding. When you put the knee against here, so you can see there is actually a gap between the 2 points. But particularly for Catherine, the main area is actually she's got issues around her hip, which is actually quite common for a lot of pregnancy ladies. They'll have often one hip is slightly higher than the other, and then to get sciatica pain and lower back pain. So on Catherine, we're going to just find your hip bones, and then Catherine's going to put her fingers on the hip bones. That's it. And you can see when I put my line against it, you can see how the hip isn't level. It should be like this for Catherine, but in Catherine's case, it's actually the left hip is slightly lower. So when you've got the vertebrates and the pelvis sitting on top of each other, instead of sitting nice and straight with a nice spacing between the two, one's actually causing an impingement and causing pressure into this lower back area on this side. And that's going to cause, particularly during the pregnancy, shooting pains, discomfort, sciatica, but also that generalised lower back pain that's going on. It also causes the pelvis to twist slightly, causing that stretch in the ligament in between the pubic bones, and that causes that SPD symptom that you can get. Also on Catherine, if you put your hands down, Catherine, you can see on her shoulders, ever so slightly, one shoulder is slightly lower than the other. And so if we just get the bone joint here, you can actually see that there is a slight change in the, one shoulder is slightly higher than the other as well. So that will also cause a little bit of restriction and tightness that Catherine sometimes moans about in the neck as well. So we're then going to just do some aim exercises, and then we're going to just check back and see what the corrections are. Okay, so you can see on Catherine, she's got restriction. When you try and go to the right on her foot, it just won't go, it keeps blocking. That often indicates that this whole section here gets tight and also gets locking further up the body. And so you can see here, Catherine, how's it feel?
It won't go any further.
Okay, and then we look at this one and you can see the difference in movement. Can you see how that is moving so much easier? And she's not blocking it, you know, on purpose. It just physically cannot move. So I'll be doing some aim work on there, and then we'll be seeing what the difference is. I've just done some aim on Catherine, and you can actually see how much movement she has got going on. And if I show you again on this side, because you can actually see that movement, and also just point your toes upwards, Catherine, and see how much looser it's all feeling. And so if you look at this foot as well, we then check to see how the equal movement is, and you can see just how much movement is going at the heel bone area. We're going to just check Catherine's rotation. So Catherine, can you rotate to your right? Okay, and then you're going to rotate to your left. Okay, can you rotate to your right again for me, Catherine? Can you see there's not much movement happening in the joints and the forefoot, and also you can see that the knee's starting to have a bit more of a strain. Can you rotate to your right for me, left for me? And can you see how you're getting a much more nicer forming arch, and all of this is moving as one solid movement. And Catherine, which side feels tighter for you?
The right.
Yeah? Okay, so we're now going to correct it up. Lift your foot for me, Catherine. Just pop that under you. Okay, and lift this foot for me. Okay, and put that under you. So, particularly during pregnant ladies, especially when you're getting the bump, the restrictions around rotation can also get affected, and so it's really important having good rotations in there. So we're going to fix Catherine up, and then we're going to show you how it feels after. Okay, so now we've done the exercise, Catherine's going to now cross your arms again and do the rotation, and we're going to see what's going on. So you can feel this is actually going a lot further, and you can get a nice smoother arch going on. And let's go to your right, which is where you have all the restrictions going on. You can actually see this is actually starting to form a nice arch, and this is actually lifting up, and you can feel that Catherine's actually going a lot further. How's it feeling to your right and your left now?
Much easier.
Okay, and how's the back feeling?
It feels more aligned. I feel more straight.
Okay, so quickly, just after looking at that, we can get Catherine just to put her fingers back on her pelvis again, and we're going to just check here. So you can actually see that the pelvis is horizontal and it's nice and straight. And if we now just check for your shoulders, so put your shoulders down, and you can already see that that has actually corrected the shoulders above. So you can feel that also here where it was all tight on Catherine. I know you couldn't see it on the video, but it was actually showing it's a lot softer as well. It's already, just doing the tiny adjustments that we've done, has already aligned her spine and her pelvis and the foot in as one fluid unit. So I'll then give Catherine this as homework to do, and I'll literally all of a couple of minutes, and it's like what I call a cup of tea exercise. There's no point giving you 3 or 4 exercises to do. You're busy people and you haven't got time, and this you can do while you're doing a cup of tea, really quick and simple, and you're done. Finally, I should mention that in my clinic I combine my anatomy and motion AIM work with systematic kinesiology techniques. I find that this is super important, particularly in pregnancy, as pregnancy can throw up a huge number of nutritional and emotional challenges that the body hasn't had potentially time to deal with or is currently dealing with, and these can be underlying causes of pain and movement issues. For example, there could be underlying trauma issues to the cell that needs to be addressed, meridian imbalances, nutritional issues. The muscle testing techniques of systematic kinesiology can therefore help me identify and address the underlying issues that visual analysis of the gait cycle and your walking pattern couldn't normally pick up. I hope you find this video really informative, and if you have any further questions, please feel free to look on our website www.tiptoefootcare.com or give our clinic a call to arrange an appointment on 0208 368 7145. I look forward to hearing from you. Thank you.